I'm Cheri McShea, the physical therapist at the Hemophilia Center of Western Pennsylvania. Today we're going to talk about joint and muscle bleeds. When it comes to bleeding, there are internal and external bleeds. External we're all familiar with. Nose bleeds, mouth bleeds, menses, cuts, incisions. However, the internal bleeds are the ones that we're less familiar with. There can be musculoskeletal bleeds, which are in our joints and our muscles, or life-threatening bleeds, which might be in our head, throat, abdomen, or they might be a severe form of the other types of bleeds. Anybody can have a joint or muscle bleed with enough trauma. However, people with bleeding disorders are more likely to have joint and muscle bleeds. They'll also bleed longer because they have difficulty clotting, therefore have a greater accumulation of blood in the joint or muscle. That blood makes more inflammation, swelling, and pain, and takes longer to heal. It also makes it more likely that you'll have another bleed in that same location. And one large or several small repeated bleeds can cause permanent damage to your joint or muscle. Risk factors for joint and muscle bleeds are moderate to severe bleeding disorders, being overweight, being inactive, or participating in physical activities that have high contact and collision. The good news is all of these risk factors can be modified. So let's talk about joint bleeds first. Joint bleeds, you may hear them referred to as a hemorrhagosis. That literally means blood in the joint. So when you look at a joint, it's where two bones meet and movement occurs. On the end of the bone, each of the bones, there's cartilage. That cartilage allows the joint to glide more smoothly. It helps to absorb shock, and it also aids in bone nutrition. Then holding those two bones together are ligaments and a capsule. The capsule is lined with a very thin layer of what's called synovial cells or synovium. That synovium is rich in blood vessels, and that's what makes the fluid that lubricates your joint. So a joint bleed occurs when there's trauma to the joint and the blood vessels get injured. Again, remember on that synovium, there's all those blood vessels. The blood vessels get injured, blood leaks into the joint space, and blood is toxic to the joint. Within minutes, there will be inflammation of the synovium, pain, swelling, loss of motion in the joint. And within hours, if that joint bleed is not stopped, it will start to damage the cartilage. The cartilage will develop some small cracks, and then the cartilage matrix actually starts to collapse. Once that happens, blood seeps down in through the cartilage to the bony surface and starts to damage the bone as well. So signs of a joint bleed. Some people feel tingling or bubbling at the start of the bleed, but not everybody does. However, everybody does feel increasing joint pain, increasing joint stiffness and swelling, decreased range of motions, particularly on the ends of the ranges. You may have redness and warmth over the joint, but you will not see bruising of that joint unless other soft tissue has also been damaged. And that's because the blood is encased in that capsule. And the other hallmark sign is that if you move that joint, it increases the pain. Complications of joint bleeds occur partially through the healing process. Your body actually forms new blood vessels to bring in more nutrients and to take away waste. The blood vessels that you start with in that joint are around that capsule, remember, in that synovium. However, the new blood vessels that grow actually grow between the bones. those new blood vessels are fragile and they're at risk to break with minor trauma. So if you think about it, if you have a knee bleed and you've got these new baby blood vessels growing between the bones and you start to walk on it, you break those new blood vessels and they start to bleed. So you're at high risk for rebleeding. The other thing that can happen is your body, again, is trying to get rid of that blood in the joint. It secretes some enzymes to break the blood down to get it out of there. Everything from that blood can eventually be removed except for a compound called hemosiderin. Hemosiderin is a result of a red blood cell breaking down. Unfortunately, it's too large to remove from the joint, so it lies on that synovium. And it can cause the synovium to become very inflamed and painful. So the synovium scars, it thickens and stiffens. So again, if you have a large joint bleed that's not treated promptly, or you have repeated bleeds, you can end up with what's called synovitis. That's that chronic inflammation of the synovium. And from that point on, that joint may be pretty cranky. It might be kind of stiff no matter what you do. And then there's also what's called hemorthropathy. When we talked about the cartilage gets broken down, unfortunately, cartilage does not have a good blood supply, so it doesn't heal. That cartilage damage is pretty much permanent, and so it decreases the ability of your joint to glide smoothly. You have decreased ability to absorb shock, and you have decreased nourishment to the bone. Now, the bone can regrow just like it does in a fracture. However, when it regrows, it doesn't grow back in the same shape that it was prior to the damage. It's a little bit gnarly and it overgrows. It can lead to grinding, popping, clicking, pain, and instability. So you can see in the photos there how that progression of cartilage and bone damage occurs. So over the course of time, you can end up with what's called hemorthropathy, which literally means damage to the joint because of blood. Now let's talk a little bit about muscle bleeds. If you have hemophilia, approximately 80% of bleeds are in the joint and 20% are in muscles. So muscles are living fibers that are bundled together to form the muscle belly. That muscle belly attaches to two different bones via tendons. When the muscle contracts, the bones are pulled together, so it makes the joint move. When the muscle relaxes, it allows the bones to move apart. Now, trauma can cause a muscle bleed. There are three ways for a muscle bleed to occur. One is a direct blow or injury to the muscle. The second is overstretching the muscle too quickly, what we typically call a pulled muscle, or overworking the muscle, which is called a muscle strain. It's too much force or too many repetitions for that muscle. So there's trauma to the muscle fiber, and that injures the blood vessels. The blood vessels bleed into or between the muscles, and again, causes inflammation, swelling, and pain. It also causes the muscle to have decreased ability to contract or relax. So basically, the muscle can't work properly. Signs and symptoms of a muscle bleed are very similar to a joint bleed, except it occurs in a muscle. You have increasing muscle pain, muscle stiffness, swelling, muscle weakness or spasm, difficulty using the muscle, decreased range of motion. It may become red and warm. A muscle may develop bruising, and that's because it's not encapsulated like it is in the joint. and pain increases with activity or weight bearing. With muscle bleeds, you may see that bruising initially if the muscle is close to the surface. If the bleed is in a muscle that lies deeper, you may not see the bruising for a couple of days, and then one day you wake up and there will be extensive bruising. That is because the blood has made its way to the surface, not because it's bled more. One of the most dangerous complications of a muscle bleed is called compartment syndrome. There are large nerves and arteries that travel between the muscles down in your arm and down through your leg. If the nerves carry messages from your brain to your limb, to your muscles, and the arteries carry blood to the muscles. Veins carry the blood away from the muscles to remove waste products. If you have muscle trauma, the capillaries bleed, large volume of blood and inflammation, the skin, it can swell so much the skin literally cannot stretch any further. So what happens is the pressure builds up inside the limb, and that pressure can choke off the nerve, which can result in paralysis, and or it can choke off the artery, which will cut off the blood flow to the rest of the limb and can cause gangrene. And again, this is compartment syndrome. Signs and symptoms of compartment syndrome are intense pain. The limb will become pale because it's not got any blood flow. It will be pulseless and cool. You will have numbness and tingling and decreased ability to make the muscles move. It'll be essentially paralyzed. This is a limb-threatening emergency. If you haven't already, you need to infuse and go to the ER immediately. They will determine how much pressure is in that limb. They'll be able to monitor it and determine whether you need surgery to reduce that pressure. The length, if they are not able to get the pressure reduced quickly with the use of factor, they may need to do a fasciotomy, which is when they open up the skin to allow the blood and the fluid to come out and take the pressure off the nerve and artery. It is a very lengthy recovery, and you may not recover fully. So again, this is an emergency situation. If you have a muscle bleed that is not treated promptly, this could be the outcome, and it is a limb-threatening complication. Other complications of muscle bleeds include, if it's a large muscle and it's a significant bleed, you can lose a lot of blood, which makes your blood pressure unstable, can result in iron deficiency anemia, some other serious complications. It can cause myositis ossificans, which is when there is a small calcium or bone-like formation within the muscle, which can be very uncomfortable and remain there for a long time. It can also develop pseudotumors, which is a progressive cyst in the muscle or the bone, and if it's in the bone, it can cause the bone to fracture. Or you can develop an abscess, which is a collection of pus in the tissue from the standing fluid leading to a bacterial infection. So how can we prevent joint and muscle bleeds? Obviously, they can do a lot of damage to our bodies. Number one thing for prevention, if recommended by your hematologist, treat prophylactically or preventively. This is often called prophy dosing. And that prophy dosing can be personalized to your lifestyle and your physical activities. Avoid non-steroidal anti-inflammatory drugs and aspirin. Both of these impair platelet function and your ability to clot. So in addition to whatever your bleeding disorder is, it also impairs your platelets and makes it even harder for you to clot off a bleed. Also, avoid or limit recreational substances that impair your coordination and judgment, increase your risk of injury, and often delay early recognition and treatment of a bleed. Other ways to prevent joint and muscle bleeds are to achieve and maintain a healthy weight. Eat a diet rich in fruits and vegetables and whole grains. Avoid processed foods, saturated fats, and sugar. And if you're struggling, consult a dietitian. They can be very helpful in helping you to figure out what works for your body. Achieve and maintain physical fitness, and that's what this program is about. And it's start low, progress slow. Too much too soon can cause trauma to the muscles and joints. Physical activity, avoid activities with high contact and collision. Use appropriate protective gear. Warm up, do your physical activities, stretch and cool down, and listen to your body. Pain is not pain. There is a very good booklet out that we have published by NHF. It's called Playing It Safe. If you don't have a copy of that book, please let me know. I'll be happy to send one to you. It has a lot of really good information about many different sports, which ones that you're able to participate in. It gives you hints about ways to make it more safe, to reduce the risk, and also how to treat an injury should you become injured. Despite everything that we do to try to prevent joint and muscle bleeds, they still do occur occasionally. So be prepared. Know the signs and symptoms of the joint bleeds. Educate key people in your life about your bleeding disorder. That may be a significant other, best friends, school nurse, coaches, etc. Wear your medical ID jewelry. So if something happens where you can't speak for yourself, the paramedics will see quickly that you have a bleeding disorder, and that becomes a priority. Consider the Yellow Dot program, and you can speak to our social workers about that. Maintain a home storage of unexpired factor and infusion supplies. Have an infusion plan. Who's going to do your infusion? Are you going to learn to do it? Is somebody else able to do it? Would you go to the ER? And keep a go bag for sports, travel, and out-of-town visits. A go bag is simply any bag that you have on hand can work. In it, you have at least one dose of factor and infusion supplies. Key phone numbers. Either keep them in your cell phone. If you don't have a cell phone, then have them written down inside the bag so that you can contact people if you need to. A list of your medications. Instant ice packs, elastic wraps and or braces, fluids and snacks, change of clothes, and a phone charger. And again, if you end up in the emergency room, this is going to make that, if you get admitted, this is going to make it much easier for you. You're not going to have to, at the last minute, hunt around for all these items that you're going to need. Emergency room tips. If you do go to the emergency room, of course, take your go bag. If you don't have a go bag, if you haven't done that, at least take your factor with you. Call your HTC, in our case, it's Hemophilia Center of Western Pennsylvania, before you go or while you're on your way. Most ER staff are unfamiliar with bleeding disorders. Our hematologist will call the ER where you're headed and speak to the ER doctor and give them guidance on how to provide you the best care. Also, please follow up with the Hemophilia Center. Additional treatment may be needed for complete recovery. Despite prevention, something happens. Now what? So for let's talk about joint and muscle bleed treatment. The goals of treatment, first of all, is to stop the bleed. If you were cut on the outside and gushing blood, your first instinct would be to stop that bleed. It is the same when that bleed is on the inside. So stopping the bleed is critical. Second of all, set yourself up for success and do things that promote healing. Once you're on your way to healing, start to regain range of motion and strength, and then return to full activity. Let's look at tissue healing. Any injury that you have, regardless of whether you have a bleeding disorder or not, the first stage in those first 24 hours is where your body performs hemostasis, and that means clotting off the bleeding. Most of that occurs within the first few seconds, but it continues for 24 hours. As you are gaining hemostasis, the inflammation is actually increasing, and inflammation actually serves a purpose. That is what communicates to the rest of your body that a lot of different components are needed to help heal that tissue. So the inflammatory stage actually exists for about the first 1 to 6 days. As that is starting to settle down, the next stage is proliferation, and that's where your body is laying down, it's doing its repair work, it's laying down, getting rid of the damaged cells, laying down new cells, and fixing things. That can last from 4 to 24 days, so 3.5 weeks. Then the remodeling stage occurs. Once all the cells have been laid down, now your body starts to organize them and help them to become stronger and have more endurance and more resilience. And that remodeling can actually take up to 1 to 2 years. So again, this is the typical progression of any type of injury that we get. Obviously, there's some variation depending on the extent of the injury. But that hemostasis in that first 24 hours is critical for the rest of those stages to occur. So if we overlay this, we want to stop that bleed and keep it stopped in that first 24 hours. Then during the inflammatory stages where we're really going to promote healing, during the proliferative rate stage, we're going to regain range of motion and strength, and then gradually return to full activity during that remodeling stage. Does this mean that you have to wait until 21 days to return to full activity? Not necessarily. It really depends on how big your bleed was and how promptly and thoroughly you treated it. If you infuse promptly, meaning less than 2 hours from the start of the bleed, you get a strong clot that forms and the bleeding stops. Then the inflammation, pain, and swelling start to subside and healing begins. So you need less number of infusions and less time to recover. And you have a lower risk for permanent damage and lifelong limitations. In fact, the research has shown that if you infuse within 2 hours, the risk of permanent damage is almost zero. If, however, your infusion is delayed, meaning it's more than 2 hours from the start of the bleed, then you have continued bleeding. You have more inflammation, pain, and swelling. The healing is delayed. You need more infusions, more time to recover, and you have a much greater risk for permanent joint or muscle damage and lifelong limitation. So to promote healing, you want to continue factor infusions as recommended by your hematologist. If you infuse promptly, you may only need one. However, depending on the size of the bleed and your activity level, you may need to continue to infuse for a while. That helps you to maintain that clot as you become more active. Again, going back to if we had an external bleed and we got it stopped and we had a scab there, if you knock that scab off before the skin underneath is completely healed, it will start to bleed again. The same thing happens inside our body. You get that good clot, but if you do too much too soon and you knock that clot off, it rebleeds. So again, the idea of continuing the infusion, you may need to continue the infusions to maintain that clot. It also allows the tissues to heal and reduces risk of complications that we discussed earlier. The number of infusions that you might need will depend on the type and severity of your bleeding disorder, the type and severity of your bleed, and the amount of time between the bleed and your first infusion. The other way that we can promote healing, in the first 48 to 72 hours, we use the acronym PRICE. P is to protect the joint and muscle from further damage and bleeding, and we do that by immobilizing it in a splint or brace. Rest, that means don't use that joint or muscle for that 48 to 72 hours, and that helps to prevent rebleeding. If it's in a leg, you need to keep your weight off of it by using crutches or walkers. I stands for ice the area to reduce pain and swelling. Apply a covered cold pack for 10 minutes every couple of hours while you're awake. If cold makes the pain worse, stop using the cold, but do not use heat. C is for compression. You compress the joint or muscle lightly with an elastic wrap to limit the swelling. If the pain worsens or the numbness and tingling develop while you have that compression on, remove the compression. And then lastly, E is for elevate the joint or muscle to reduce swelling. If possible, elevate that body part above the heart. Then we move into the stage where we can start to work on regaining strength and range of motion. I can't emphasize enough how important it is to start low and progress slow. Too much too soon can cause a rebleed and delay recovery. Muscles actually take longer to heal than joints. As the inflammation is decreasing, as your pain is going down, your swelling's going down, you can start to begin some gentle exercise. The exercises that I recommend initially is called isometric exercise. It's where you contract the muscle, but you don't move the joint. You start out with 3 to 5 repetitions several times a day, then gradually increase the number of repetitions and the amount of force you apply. Then, after you've started the gentle isometric, you can start with gentle range of motion exercises within your pain-free range. Again, 3 to 5 repetitions several times a day. Gradually increase your number of repetitions. Don't force your range of motion. Don't go into your painful range. As your swelling goes down, your range of motion is going to naturally increase. So it's really important that you continue with that those price strategies that we reviewed earlier to help get that swelling down so that your range of motion will increase. As far as activities, start with light activity, avoid activities that cause or increase your pain, and gradually increase your weight bearing. Please reach out to me. I'm happy to help you through your recovery phase. I can send exercises to you. You're welcome to come in and we can go through the exercises together, whatever works for you. And then there's return to full recovery once you've started to get some range of motion and strength back. Once you have full range of motion with no pain, and no pain with light activity, meaning dressing, bathing, walking around the house, then you can start some light resistive work. The resistive bands and weight machines are safer than free weights. Same thing, start low, progress slow, 5 to 10 reps once daily, then gradually increase your repetitions and gradually increase the amount of resistance. Outpatient physical therapy is recommended if you've had a large bleed or repeated or complicated joint and muscle bleeds. It's also recommended if you want to safely return to a physically demanding activities, jobs, or sports. If you believe that you'll benefit or you've been referred to outpatient physical therapy, please let me know. I will contact your physical therapist or occupational therapist and provide some education on bleeding disorders and some of the rehab guidelines that go along with that. Most physical therapists have not worked with somebody with a bleeding disorder, and I find them very receptive to the information that they're given. This will make your physical therapy experience much safer and help to prevent a bleed because of the physical therapy. Rehab guidelines for people with bleeding disorders, I think not only is it important that the physical therapist know, but I think it's important that you know. If it's recommended by your hematologist, prophy dose, if you remember, that's the prevention dose right before you go to physical therapy. Therapy should start low, progress slow. Typically, I tell the physical therapist, start out at 50% of what you would give somebody without a bleeding disorder and progress at 50% the rate. Avoid passive range of motion, which is where the therapist is trying to is physically touching you and trying to increase your range of motion. Avoid heat modalities, deep massage, joint mobilizations greater than 2, heavy resistance, and aggressive electrical stimulation. If you would have signs or symptoms of a joint or muscle bleed during physical therapy, discontinue the physical therapy immediately and only resume once the hematologist has cleared you. And of course, contact the Hemophilia Center for proper treatment. So our take-home message with joint and muscle bleeds are partner with us to set up prophy dosing that's right for you. Make healthy lifestyle choices. Be prepared. Know the signs and symptoms of joint and muscle bleeds. Have factor and supplies readily available. If you do have a joint or muscle bleed, or you suspect that you do, treat promptly in less than 2 hours, including factor infusion and price. Partner with your Hemophilia Treatment Center to treat the bleed and regain strength and range of motion. Return to activity gradually to avoid rebleeding, and consider outpatient PT for complex bleeds or return to vigorous activity and sport. Thank you for taking the time to listen to this video, to watch this video. If you have any questions or concerns, please give me a call. Thank you so much.